Hi everyone, we're doing some PRP on Tom today. So he has had it once before. He's also getting end-sculpt at the same time, so we're just hitting him with everything. But I already drew his blood. I spun the blood down, 4 little mini tubes, not a lot, and separated out the platelet-rich plasma, so you get this nice liquid gold. This is then injected into the scalp. So as we age, we get more fallout. He gets a little bit of fallout in the front, a little bit of thinning. He has great hair, but this is really for maintenance for him. So we'll inject the whole top of his scalp, where men start to lose their hair the most, which is the temporal area, the crown back here, sometimes even in the center here. And this will just help maintain everything. It will strengthen everything, prevent him from having more fallout. He'll still have normal fallout, but this helps so much. He'll do multiple treatments in a row. He's had a treatment in April already, so now he's really just doing maintenance treatment. It takes 10 minutes to do, and it's quick and easy. And you can do end-sculpt at the same time.